we have 100,000 patients a year. 800,000 persons in the United States that have a stroke every year. So it's very common, and 150,000, they die from the stroke. This is a serious condition. But anyway, after working in the hospital, I started realizing some patients with a stroke has serious difficulty expressing themselves, okay? Despite they call the speech therapy and physical therapies, or you maybe go to a nursing home or a rehab facility, you still, after 5 or 6 weeks of treatment, you still cannot talk. Usually these patients are paralyzed one side, okay? So they cannot write, they cannot talk, but they understand. So what happened, and I was discussing this with my wife, I said, I feel really bad for these people because now they're in a nursing home, they're stuck in some home, and the family doesn't know what to do with them because there's no communication, they cannot connect. We need to find out a way. They say, I want to find a way to help these people.
You're listening to Cold Press Conversations with Dr. Jewel White Williams, a lover of numbers, lists, and a good glass of cold press juice, who is sharing episodes each week to help you explore the back end of healthcare and health sciences. Where a lot of that grit is done, we'll dive into topics covering research, education, and clinical practices, as well as guest shows with other leaders in the field. Pull up a seat and let's dive into these amazing and game-changing conversations. Hello, and welcome to Cold Press Conversations. I am your host, Dr. Jewel White Williams, and I am elated that we're going to be discussing about health and health literacy. And my guest today is Roberto Mixco, and he is with us today from sunny Florida, correct?
That's right.
Hot dog. Yeah, I love Florida. My husband is actually a Miamian, so that's where his family is. But I just want to say thank you so much for just coming on to today's episode of Cold Press Conversations. He is an author. I have to say he does quite a bit. So let me just give you a little insight. He is a board-certified neurologist practicing in Central Florida, born in El Salvador. His wife of 43 years, Eva Marie, is the editor of his book. And he has 3 beautiful children, Anthony, Carlo, and Janina. Janina. And it's just amazing that he is going to give us some insight on something called the one-handed non-traditional expression for patients who had a stroke. And the positive thing about this book is that it is written in English and it is written in Spanish. And if you have any insight to a little Spanish, it is very easy to read for anyone who has questions. It is something that is very simplistic for someone to understand and to help someone who has had a stroke. But before I even go any further, I would love for you to just give us a little insight, Dr. Mixco, a little bit about your background and your experience.
Yes, ma'am. I came to the United States about 1982 to pursue a career in neurology. So I went to University of St. Louis, Missouri. Then I did 2 more years in Louisville, where I graduated, and did we call fellowship, 1 extra year in neurophysiology. And then came to Central Florida, and where I have been here since then. I came from El Salvador. Now I have 3 grown-up children, has 5 grandchildren, and we're having a great time with all the children. I work in 3 different hospitals in the area, but when time passed by, I decided to stay in only 2 hospitals, then only 1, and then basically right now only outpatient clinic. That's what I'm doing now. Yeah. After 40 years taking calls, I pay my dues. I don't need to take more calls.
That is awesome. That's awesome. Now, are you currently practicing?
Yes, I just saw patients 10 minutes ago.
Yeah. Just practice. Yeah, just a few minutes ago, huh? So help me understand just a little bit about your book to help us understand more about the communication needs. Like, what made you decide that this was a necessity for our patients that are out there with stroke?
Well, what happened is, as every neurologist, you go to the hospital and see patients with a stroke. It's very frequent. We have 100,000 patients a year. 800,000 persons in the United States that have a stroke every year. So it's very common, and 150,000, they die from the stroke. This is a serious condition. But anyway, after working in the hospital, I started realizing some patients with a stroke has serious difficulty expressing themselves, okay? Despite they call the speech therapy and physical therapies, or you maybe go to a nursing home or a rehab facility, you still, after 5 or 6 weeks of treatment, you still cannot talk. Usually these patients are paralyzed one side. Okay. So they cannot write, they cannot talk, but they understand. So what happened, and I was discussing this with my wife, I said, I feel really bad for these people because now they're in a nursing home, they're stuck in some home, and the family doesn't know what to do with them because there's no communication, they cannot connect. We need to find out a way. They say, I want to find a way to help these people. And I think what I did is I realized they still has one hand. They use one hand. So what happened when you talk about sign language, you're talking using both hands. Sign language is about 25,000 words, and you will not try to teach 25,000 words to a patient with a stroke.
No.
That would be crazy. So I came with the idea to use only 100 signs, only using one hand. So the patient understand, the family understand, they can communicate. Some of the signs you already know them, like hello, bye bye, good, bad. So it's easy. Every page has a picture in the center of the page in color that you want it. It can be in black and white or in color. And in 2, 3 lines, will explain the sign. And then the family can, in 2, 3, or 4 weeks, can start communicating with the patient. It's very simple. It has to be simple. And the book will tell you at the beginning, you can make your own sign. You can invent one sign. You want a sign for Uncle Freddy? I made one sign for Uncle Freddy. You can say, this Uncle Freddy, okay?
Yeah.
So what happens, if you don't like one sign, you can scratch it. That doesn't matter. The idea is really, yes, these people can communicate. There will be no abandoned or isolated. And they can communicate with the family, with friends, with anybody. I mean, anybody could take the book, can do that. So that's basically the idea of the book.
Okay, that's good because I do want to read one part of the book that I think is important. That in your introduction, which your wife did help you with a lot of the book, from what I understand.
Yeah, she's the editor.
Yes, yes, yes. Speech pathologists can help patients regain communication skills to a significant degree. However, regardless of their exceptional efforts, a large number of patients are unable to articulate their thoughts, and it's called expressive aphasia.
That's right.
And so it's harder for them to communicate with expressive aphasia. Now, I want to take a back step. I think we need to educate the community just a little bit.
Okay.
The first thing I want to educate in them is signs of a stroke.
Okay, yes. They're trying to make very aware of the public. They use the normal technique, use FAST. F mean face is involved, A mean arm is involved, S mean speech is affected, and T mean time to call 911. Because there's treatment now for a stroke, and usually in the ER, the first 4.5 hours, there's some medication called TPA that you can dissolve the clot. Okay, so there's a second treatment. It's called embolectomy. They can identify the clot, they can suction the clot, but that's just another window of 6 hours. But in all the United States, different hospitals have tertiary centers, primary centers. But the point for the family and for everybody listening to this, as soon as you have doubt about this, you go to the ER because the time is running. You show up 6 hours later, very little we can do for you. So you have to show up as soon as you can. So we need to educate the public about what are the signs. If you have a speech problem, you don't move your arm, you cannot talk properly, something going on, time to go call 911 and take it to the hospital. I mean, because there's treatment.
Right. And I think that's the reason why I wanted to bring that up, because having you as a neurologist here, I think it's important. And then what you're doing is you're stating also that we also have speech pathologists who are there to help them after they've had a stroke if they need those services as well. And that's where you're putting the 2 and 2 together. I do want to ask you, what are some of the advancements that have happened in neurophysiology that have advanced some of the patient outcomes in neurology? What are some advancements that have occurred for neurology?
We believe in neurology, we call neuroplasticity. The nerves, the brain has chances to renovate, to reconnect, and that's the reason it's so important, the physical therapy. There's just a new treatment called Vivis Team, in which you have a stroke and your arm is weak even for 3 or 4 years. This new treatment can help you to recover some of the strength. This is something new that is just barely available in some places in the United States. Called Vivis Team have a device called BNS that connect with some nerves in your neck, and the neck, this particular nerve called vagus nerve, connect with the whole brain. So this is amazing because I am contacted one of my patients has a stroke 20 years ago. He's paralyzed in one side. He will be my first patient going to try that because this is something new that people are not aware of this. So everybody there who is physical therapist, you better check this because called Vivis Team, and that is something new. It's very important that people be aware of that. It's also important that when you have some of these symptoms of stroke, you go to the hospital. You will be surprised how many people stay at home. They say, I will fight the stroke. Say, how are you fighting the stroke? Well, you lay down in bed and see and concentrate. No, no, no. You go to the hospital. And also speech therapy can help you. And the physical therapy can help you. It's a whole team. So it's important to usually start happening the wrong time.
With me in the hospital setting, I do see some people would prefer to just go home and not go for physical therapy or speech therapy, not knowing that that can help. That can help. And it sounds like more advancements are occurring, which is
Some
great.
people could have 100% recovery in a matter of 3 or 4 hours.
Yeah.
With these two
Right.
treatments.
Exactly. If you get it within that 6-hour time frame.
Yes.
Yeah. That's why I really wanted you to come on. I wanted to talk about the signs. I wanted to talk to the advancements, the people who are part of the interdisciplinary team to help you become better should it have affected you physically, and then discuss how this book is just making such strides in a family. Do you mind if I show them something? It's really
Go ahead.
cool. All right. So, Cold Press fam, I just got to show you. The book is, hopefully, I can show. That's why I wanted to get the right one. He has the pieces here. It shows how you can do wife. He also shows you how to do husband. He goes through the whole book, and it's written in Spanish as well. Able to, poder, and it goes into each one. It gives us in the English and it gives it in Espanol over here. So it gives us all of it. And I really appreciate the way that you have this book lined up because, like you said, it's not a lot that's there, but it gives us some.
You just start with, you can invent your own sign.
And I like that you gave the modifiers here. I think that's important, showing the modifiers and helping people understand that they can actually, and you even mentioned they can come up with their own signs. So
That's
that you
right.
can communicate with your family. Do you mind telling me how many of your patients have had a chance to take access to some of this information that you have given to them? And have you given it to their families when they've had it, when you know that they need to recover? How do you introduce this book to your patients?
Every time I have the time to see a patient in my office who have a stroke, I talk to them about the book. And when somebody has that particular type of stroke, expressive aphasia, they will be surprised as they say, how nobody told me about this. Well, I'm telling you about this. And everybody in the family can participate, It's very important because I have a particular case that's very important. This is a patient who has no stroke but have a head trauma because this book can help people with head trauma, advanced Parkinson, patient will get in deaf. There's so many other issues, vocal cord paralysis, throat cancer, so many different other issues that can affect your speech. But this particular lady, she was in high school. So the last day of high school, they went to celebrate with a friend, have a terrible accident, and she has intracranial bleeding, and she was not able to talk and was paralyzed on one side. So I have a stroke because they had trauma. But what happened, her mother decided to learn the real sign language, spent 2 years to learn sign language, and teach her daughter as much as she can for 2-3 years, and they're able to communicate because she took that chance. Okay. Now, nobody else in the family want to do it. No the brothers, no sisters, no the father, nobody, only the mom and her daughter was able to do that. So when they saw my book, they start crying here in my office. They say, oh my goodness, everybody can do this. My neighbor can do this. I mean, anybody who has a little bit of patience can do this. You don't need to learn 20,000 together. I mean, this is very simple.
Wow.
Very simple book.
Yeah, and I like it because it's applicable. When we talk about health literacy, it's a way to communicate in a way that people can learn. And that's one thing that you're doing. You're providing them an opportunity from you doing research, seeing that the needs and the education that you have will help advance those with aphasia so that they can actually communicate with their family members. And I appreciate what you're doing with that. I just have one more question for you. I hope you don't mind. What do you see in the future? Some changes and some opportunities in neurology, probably within the next decade or so?
In general, in neurology, we make advances in all different aspects. We have patients with dementia, Alzheimer's. We have medication for Alzheimer's now. People need to be aware of that. And you have to talk with your neurologist because this new medication came 2 years ago, the first one, and the second one last year, and the third one coming next month. What happened, this medication really treat the real problem of Alzheimer's, the amyloid plaques. So this is something that is happening in patients with dementia or Alzheimer's. Alzheimer's is one of the type of dementia. There's various types of dementia, but that's something that everybody is aware of. Patients with multiple sclerosis, there's so many treatments right now. This is unbelievable. When I started practicing in Florida, we had no medication, zero. So only give you some steroid and physical therapy. And then came the first one. And everybody want that medication that we had to make a lottery to see who can get that medication.
Oh
Yeah.
my God.
And then the second one, the third one. Now we have over 30 different products to treat multiple sclerosis. Parkinson is a lot of advances in Parkinson. So, it's not just a seizure, epilepsy. There's new ways to treat seizures. I mean, so is medicine and neurology. I mean, it's changing. In the past, neurology was famous for make diagnosis and just watch what's going on. We had no treatment before. When I came to practicing, the treatment for the stroke was an aspirin. That's it. Take one maybe aspirin. That's it. And now we have all these different treatments. I mean, medicine is changing and also neurology. So we are happy to be able to offer so many options to the patient right now.
And I love that. I love that. A lot of people, when we talk about neurology, I told you I have my mission. I want people to get educated. When they talk about neurology, so many people just think of just the nervous system collectively, but they don't think of Parkinson's. They don't think of Alzheimer's. They don't think of stroke. They don't think of the whole list that neurology is with.
Yeah, migraines. There's
Right.
a lot of medication for migraines. That is so common. Yeah.
Yeah, and it is. It really is common. And I think that's why I really wanted you to be here to just sort of let us know that there is impact on the type of
Yeah.
practices that are here for neurology and that there are many advancements that are occurring. And I just appreciate you just elaborating on that. I really thank you so much.
You're welcome.
I really do. What is one thing that you would like to leave to those who are listening as a big insight for them in regards to neurology or even just stroke in general? What is one big takeaway that you really want them to have from this interview?
Well, they should be aware that the treatment for stroke are improving and it's changing. A few years ago, you had this medication, you need to show up the first 3 hours. Now we increased to 4 hours and 30 minutes. Now it's new studies showing that probably will be more than 4 hours and 30 minutes. Probably going to be 6 hours. In some other countries, they even change. I mean, we treat in 12 hours. So this keeps changing. I mean, there's new medication that being used for this treatment called TPA, but there's another one that is already been used in the United States that is a little better than another one. So changes are happening. Science maybe progress very slowly, but progress. So don't be shy and ask your primary doctor, any question you have about neurology or cardiology, because in every different part of medicine, these advances happening.
That's good. And I appreciate you saying that advances are happening. Start to ask questions. I think it's important for people to know that questions are important. And that's one thing I know that you like to have, I'm sure. Have your patients give you questions. You want to answer them. You want to help them.
Yes. Can I say something? When you go to your doctor, make a list of your question before you go, because they will tell you, so they're having a question and you didn't prepare for the question. They say, okay, that's it. We'll see you in 3 months. You need to do your homework. You need to do the homework and be ready with 2-3 questions that you really want to know. But you have to do that before. This is your medication because your doctor wants to know what you're taking. A lot of people say, I don't remember. Call the pharmacy, call my friend, call them. I mean, no, you should bring your pills. I mean, it's important, has to question 3 or 4 questions. Don't bring 25 questions. That's nobody will answer that. But 3 questions, yes.
Yeah. Come with 3 questions. Come with 3 questions. So often when people hear neurologists, they get a little antsy or maybe apprehensive. But
Yes.
the thing about it is you have a wealth of information to help the patient become better or at least become more controlled in what they're doing or at least offer some additional services for them. I have one more question. I'm sorry.
Yes.
What are some other areas when you have your interdisciplinary team for someone who has had a stroke or someone who has a neurological condition? What are some other key players that actually help out a patient? I think it's really important for people to hear that. I know we mentioned speech pathologists and I know we mentioned physical therapists, but who are some other people who actually help out?
Occupational therapy is very important. Family is very important to get involved. We like when the family get involved with the patient because they can help to monitor medication when maybe the patient has problem with memory, And now we have people that put cameras in the houses because the patient live alone. You have no idea how many elderly person live alone. So that's scary because they have they can fall down and then nobody know what happened. Sometimes they found you 3 days later with pneumonia already, dehydrated, or maybe even worse than that. Okay, so it's important to the family to get involved.
You hit it
You
nail
need
on the
to,
head.
yeah.
I'm glad you said it because I know I talked about the hospital. I know I talked about the community, but the community is the family. And I'm so
Yeah.
elated that you mentioned that because that's important.
Yes.
That's very important. Well, Dr. Mixco, I am elated that you came on Cold Press Conversations. You have provided us with a wealth of information in regards to neurology, understanding what you as a renowned neurologist do, coming from El Salvador and getting into the advancements of neurophysiology and how it has helped improve the outcomes. And your book itself, like I said, it is a quick read. For
Yeah.
those of you who have a chance to look at it, it is written in English and in Spanish. Like I showed you the pictures in it. I like it because it doesn't matter your level of reading. It doesn't matter the level
Yeah.
of your knowledge. It's simplistic for someone to just communicate with their loved one.
Even there's a little cartoons. You see the little cartoon next to the pages, so make it easier to remember, you know.
It does. It really, really does. And I really like it. And everything's, like you said, is one-handed.
Yes,
Everything is
right.
one-handed. And I think
Yes.
that's what matters. Like I said, I do like it because here are your cartoons right here.
Yeah, the cartoon. My wife made all those cartoons. And my daughter is the model, and the book is my daughter.
Oh, really?
Yeah, that's my daughter over there. There's two girls. One is somebody who was the daughter of one of the employees in my office, and one is my daughter.
Oh, that's beautiful. Yeah, because I think she's doing Young Man.
Yeah.
I think she's doing Young Man.
Yeah,
Yeah.
that's my daughter. It's a family affair.
There's nothing like family, and that's exactly what you said at the very end. I just want to thank everyone for joining me on Cold Press Conversations with Dr. Roberto Mixco, and he has done a phenomenal job explaining to us about neurology and the impact of those who have had a stroke, the services that can be offered, and how family is part of your team. I hope you enjoyed this episode of Cold Press Conversations. If you love this episode as much as I did, I need you to head on over and subscribe so you never miss an episode. This is Dr. Jewel signing off to health and cognitive happiness.